My name is OJ Watson. I'm a lecturer in infectious disease modelling at Imperial College London. My work is really in three main areas: on drug and diagnostic resistance in malaria, on pandemic preparedness and estimating the impact of vaccination programs, and also in humanitarian response, so understanding how modelling can be used to support the response during humanitarian crises. So this hackathon came about from a project that I am doing with CEMA and with Paula Kristen, who's based here in CEMA. And this project was trying to understand whether the outputs that were being produced during the COVID-19 pandemic were really the best outputs for public health decision makers. So this work, we were conducting surveys within decision makers in low and middle income countries to understand exactly how they would like to receive outputs from infectious disease modelers, what were the most useful outputs, and how we can do knowledge translation better to support individuals during pandemics. However, during that project, we thought, actually, why just limit it to COVID-19? And so myself and CEMA, we put together this hackathon to develop new tools that would assist public health decision makers by addressing specific needs that they had for tools where academic researchers could leverage their skills working on key questions and producing these tools that would address those public health needs. What has worked really well for this hackathon is prior to this week, CEMA had undertook a number of conversations with decision makers in the Ministry of Health, reaching out to them to understand the needs that they have. And from those, we have invited a number of decision makers to the hackathon this week, and with them they have brought some of the data that they have that they want the individuals here to provide insight on. And having done that up front has been really helpful, because it has meant that the teams here today have been able to build really impressive models. So for example, there's a group working on looking at measles thresholds for when there's likely a measles outbreak, and they've been able to use data shared by the Ministry of Health to build measles infectious disease models to better understand the spread of measles in a subnational way across Kenya. And that really would have only been possible from those initial conversations with the decision makers who were able to share that data in advance of the hackathon. I think prior to the hackathon, one thing that we wanted to make sure we did right was how we were going to bring together individuals from Imperial College London, individuals from CEMA, and then the public health decision makers all in one room for 5 days, and how they were going to work effectively together. So we came up with an icebreaker activity, which is a game of Jenga, but each of the Jenga bricks has a small icebreaker question on it. So for example, what is your favourite sport? Where's the best place you've been on holiday? What is your favourite food to eat? And just these silly little questions in combination with playing a game of Jenga, I think worked really effectively to bond people, and it's really been paying dividend, because certainly each day each group is quite keen to play some more Jenga, which I think is both to want to play Jenga but also to understand more about the people they're working with today. And just this morning we asked individuals at the hackathon if they could let us know 3 things that they'd learnt about the individuals in their team, and everyone had their hands up because they wanted to share what they'd learnt, and also because we had a small biscuit-based prize for any individuals who could tell us about the team that they're working in.